Morning, Dr. Korst.
Good morning.
Hi, my name is Prisca. I'm the lung cancer nurse navigator at the Valley Hospital.
And I'm Dr. Robert Korst, and I'm the director of thoracic surgery at the Valley Hospital.
And we're here to answer the community's questions about lung cancer screening. Dr. Korst, how common is lung cancer in the United States?
So lung cancer is a very common disease in this country. Actually, about 230,000 people are diagnosed with lung cancer in this country every year. But even more importantly is that lung cancer is the most common cause of cancer death in the United States. And the reason for that is that most people with lung cancer are diagnosed when they have symptoms, and they're diagnosed when they have advanced disease, which is incurable. And so it becomes important to be able to pick up lung cancer at an earlier stage.
And who is at risk for lung cancer?
So lung cancer traditionally is a disease of more elderly people and people who have smoked in the past. However, there's clearly a population of patients who have never smoked, but smoking is the biggest risk factor. Smokers can be active smokers, and we also diagnosed lung cancer in patients who have smoked in the past and who have quit. In addition to that, another environmental exposure may be radon in the house, and it becomes important to test your house for radon, because if you have elevated levels of radon in your house, you should have that fixed. The number one thing people can do to reduce their risk of lung cancer is simply to stop smoking and reduce their exposure to secondhand smoke. Who should be screened for lung cancer and why?
So the U.S. Preventive Services Task Force recommends lung cancer screening annually for patients who are between 50 to 80 years old, who have a 20-pack year smoking history, and who are currently smoking or have quit smoking in the last 15 years. People should be screened because we want to cure more people. The earlier we catch lung cancer, the earlier that we can treat. Annual lung cancer screening has been found to decrease mortality rate in lung cancer.
So what is involved in lung cancer screening?
So the first step is to talk to your doctor about your eligibility. It should be done annually because lung cancers are usually found in follow-up exams. The test itself takes about 2 minutes, and there's no needles, no injections, no pain. Results will go to your doctor, who will discuss any follow-up you need. What about the radiation risk from CT screening?
Yeah, that's a good question. So it's important to understand that we as Americans are exposed to radiation just every day by walking around and conducting our everyday lives. A single screening scan is due to about 6 months worth of radiation that we just get by walking around and conducting our everyday lives. How can I get screened for lung cancer at Valley?
So first, you would talk to your doctor about your eligibility. If you are eligible, they'll enter an order, and a member of our Access and Navigation team will schedule the exam. In the minority of cases where a concerning lesion is found, our care team can manage all aspects of your treatment. If you'd like to have more information or have further questions about lung cancer screening, you can reach the Lung Nurse Navigator.
Now, just because you have an abnormal finding on a lung cancer screening CT scan does not necessarily mean you have lung cancer, correct?
This is true. So your doctor will discuss whatever the follow-up is for whatever findings that come up on your scan. For more information, check out Valley's website.
And stop smoking.